Private members' business, notice number 3, for a motion relating to the introduction of Medicare.
Call the member for Werriwa.
Thank you, Deputy Speaker. I move the motion relating to the introduction of Medicare in the terms in which it appears on the notice paper. At 6:06 on the 6th of September 1983, Dr Neil Blewett, Minister for Health in the Hawke Labor government, rose to read the Health Legislation Amendment Bill 1983 into Hansard in this parliament. These were the acts of parliament that created Medicare out of the ashes of Medibank and provided Australians, and I quote Minister Blewett, a health insurance system that is simple and affordable. 39 years on, we mark the anniversary of Australia's first-class, world-leading universal health system, Medicare. Labor governments have prided themselves in championing equitable and universal affordable health care as a right for Australians. I remember the discussions in my family between my parents before Medicare about who should go to the doctor, what our family could afford and who was sick enough to justify the cost. The Green Medicare card meant that our family and Australians all around our country had access to support and medical advice they could afford. The relief of my parents was obvious to me. It was Labor governments of Whitlam and Hawke who introduced these reforms. Whilst the first reforms of the pharmaceutical benefit scheme date back to a Chifley Labor government. It is Labor governments that establish our world-leading healthcare system, and the Albanese will continue to defend and strengthen it. For the first time in its 75-year history, the PBS has been amended to provide Australians with life-saving medicines at a cheaper and more affordable price. With new medicines being added to the PBS monthly, it remains crucial that they are accessible should Australians need them. It is the government's responsibility to ensure that there is equitable and available access to medicines and to health care. The last decade has seen this dwindled. The continued freeze on Medicare has forced doctors out and bulk billing rates to drop. In communities like mine and all over Australia, it is harder to see a GP, and more GPs can no longer afford to bulk bill. The release last week of the report of the Strengthening Medicare Task Force sets recommendations that the Albanese government are currently working through to turn this around and rebuild the systems all Australians have relied on for the last 4 decades. Australia's healthcare system ranks among the best in the world. It's an achievement to be proud of, and Labor will always be the party to defend and support it. We understand that for Australia to prosper, it needs a healthy population, and no barrier, especially financial, should hinder a person's ability to access the healthcare and medications they need. The Australian people are currently facing costs of living crisis, and our government should not shy away from supporting Australians during the difficult times. That's why, from the 1st of January 2023, the maximum co-payment was reduced by $12.50 to the new maximum of $30. There are 3.6 million Australians who use prescriptions over $30 a month, who will, from the 1st of January, saved on their scripts under the Albanese government. I've heard constituents tell me of their experiences of being prescribed life-saving cancer medication that would have cost them thousands, if not tens of thousands of dollars, who can now focus on getting better rather than worrying about how or if they can afford the treatment prescribed. But unfortunately, I've also met with constituents, those with chronic conditions, who make choices about the medications they can afford. And this is becoming more and more common as cost of living pressures mount, and it is obviously the most vulnerable that are disproportionately affected. Australia must never be a country where people must choose between providing food and shelter for their family and seeing their doctor or filling a script. There should never be a moment in this country where people are forced to ration healthcare or face bankruptcy, as was the case before the introduction of universal healthcare in Australia. Labor's measures to reduce the cost of vital medications is another step in that direction. We promised to reduce the price of medicines in our 22 election platform, and we delivered $190 million a year directly into the pockets of Australians. We are a country that ensures that all Australians receive the medical care they need, regardless of income, and that should always be the pillar of our healthcare system. Labor is a party of Medicare, and the Albanese government will ensure that our healthcare system is continuously defended and strengthened.
I thank the member for